In my early 20s, I started having back problems, especially a lower back pain that would go through my left leg.
I was a nurse, pushing patients on a stretcher, a labor and delivery nurse, bending down, had back pain frequently.
Athletics has pretty much been my life. So, it's my passion outside of work and family.
I'm a neurologist. I've been in practice here in Plano for 26 years, and I treat neurological diseases.
I went on a ski trip with my children and put my ski boots on and went down the mountain for 20 minutes, and I knew it was time for me to have surgery.
I have some discs that started to compress, and so I'd had some shots to help alleviate that pain. And then I was running one day and caught myself in a transition in the pavement and went down, and at that point I did some further damage to my back and my shoulder. So that pretty much was when I had to make a decision.
I injured my back while playing soccer, and I actually hyperextended my back while slide tackling. And later that night, I began experiencing pretty severe back pain, and I began experiencing pain traveling down my left leg. And as a neurologist, I knew right away what the problem was. I figured that I probably had herniated a disc in my back.
I was diagnosed with a ruptured disc and degenerative disc disease.
They discovered I had 2 herniated discs, and I tried everything I could, therapy, injections in the disc, but nothing worked. So my doctor suggested that it was time to see a surgeon.
Well, I was recommended to Dr. Vignucci from my physical therapist, and he was one of the first doctors that I've seen that said that I could go back to doing the things that I loved in my life, which is running, biking, swimming, and that type of thing. So to me, that was critical, because that's a passion that I have, and I really wanted some normalcy back to my life, and I hadn't been able to do it for like 7 months. So it was a blessing, to say the least.
I know he's extremely intelligent, and I know he's the best around. All the nurses at the hospital love him, and he has a great bedside manner, and he's comforting. He doesn't force you to just jump into having your back operated on. I just knew when it was time for me to have surgery, he was the right guy to go to.
I think he's an excellent neurosurgeon. He's very well trained. I've known him for a long time. I know many of his office staff. I know many of his physician assistants, and he has a first-rate team.
But I knew when I went to get in there, he wasn't going to push me to the next level. I mean, he really looks at everybody for what care they really need for whatever it is. I don't think he pushes anything too extreme that you need to have unless he really feels like you have to have it done.
I tell everyone to go to Dr. Vignucci.
Dr. Vignucci is a very personable person. He's a gentleman. He communicates very well. I've always been pleased with sending patients to see him because he is a person who's willing to talk and explain things.
I just think they're just really friendly. I look forward to coming in here. I really do.
It's not only the medical help that is very obvious, because that's their job to make you feel better, but also the human part, understanding that I needed something that maybe it's not their job to give it to me.
Real comforting, the atmosphere is real soothing, and just a nice place to come and feel secure.
The following day, I came over here to the Windhaven Surgery Center and had the back surgery.
And I decided to have the surgery, and if you see my medical history, I haven't been to the doctor with the same complaint ever since.
I had a 360 fusion and was in the hospital for about 5 days, and it changed my life. It was hard to recover from, but it was the best thing I've ever done.
I've gone back to playing soccer, so I'll give you an example of how well I'm doing. So I was very pleased with the outcome.
I brought my father here to have surgery with him. He's 76 years old, and he had surgery this past January, and he's doing great.
Well, for me, it worked. I couldn't lay down. I couldn't run at all. I couldn't do anything with any impact at all, and more or less even standing. It was painful. So, to have everything back to me, I can't really imagine not having that. So